Hi there, Tracy Peary with Hope for the Journey again. I get a lot of questions about what dissociation feels like to the client. Most people assume that people are aware of when they're dissociating. And in my experience, some people are, right? Some people know what that experience feels like and they've got words for it and they can tell you, and that is super helpful for your therapist. Or if you are a therapist, right? It's super helpful when your clients can tell you that. But 9 times out of 10, it's not just intuitive. They don't necessarily know that they're dissociating. What it feels like on the inside, like neurologically, what's going on inside the client, or biologically, what's going on inside the client is that things are actually fired up, right? So when someone is dissociating, if they had biometrics that were taking their temperature, taking their heart rate, taking their blood pressure, things would be accelerated, right? Their heart rate's up, their temperature's up, their blood pressure's up, things are boiling. But interestingly enough, the way clients will often describe that internal experience for themselves at the exact same time is that they feel nothing. Sometimes they'll describe it as feeling foggy or feeling disconnected or further away, right? Or it doesn't feel real. It feels like a movie that you're going through. But oftentimes they'll just describe it as, I don't feel anything, right? And that's what's happening for them. They don't feel anything. But if you were to take all of their temperature and all of these other things, things would be going on. So that's an important thing to remember, because especially if you are like doing your trauma work and you check in with them and they're like, nothing, I don't feel anything. Sometimes a therapist might make the mistake of thinking that means, yay, we're doing great, and go full speed ahead. But if instead you get that report of, I don't feel anything, you can tease that out a little bit and say, well, hopefully you've built skills at this point for them to be able to have words, just to know that when they feel nothing, that means dissociation. But if you haven't already, you can help them tease that out by saying something like, so do you feel calm or neutral in your body, or do you feel nothing, like it's blocked? Usually that can help tease it out. And sometimes clients will still say, no, I'm good, because that does feel good to them. But as you're going through it, they're not getting better, or you're starting to, your spidey senses are going off and noticing that something doesn't feel quite right. Or maybe you're having some of those physical symptoms that I've talked about in the past, where you notice a client is dissociating based off of what's going on in your own body. I've got a great video on that if you haven't checked it out yet. Say something like that's going on and they're still saying it's okay. You know that you can slow things down and go back until you can get them to come back online. And it just slows down the process of the treatment so that you know how to pace and stay safe, because you don't want to plow through when somebody's dissociative without knowing it and without having bumpers in there, because otherwise what can happen is it's kind of like walking through a landmine in the dark and you're not even caring about where you step, right? Because you don't know that there's landmines. But if you know that there's landmines and you decide to walk in that field, you can do it in a much more careful way and hopefully have some sensors to know what's going on, that sort of thing. All right, so that's what it is in a nutshell. What clients feel in the body when they are dissociating is actually not what we would normally expect. Hopefully this was helpful. If you want to learn more about dissociation, sign up for a course. Even if you're not able to be there live, which I highly recommend, because we're going to have Q&A time. There's going to be experiential. It's going to be awesome. And this is really something that you can use with all the other trainings that you've had to be able to get a lot more effectiveness with your more complex clients. But even if you can't make it there live, signing up gets you access to the recording so that you can watch it in an on-demand fashion. You'll still have access to the CEUs at that point. And yeah, we want to know. We want to know what's going on with you and help you to work with a greater variety of clients and start to feel really confident working with dissociation and complex trauma. Thanks so much.